Good evening, ladies and gentlemen. Welcome to Royce Hall. The commencement will begin in a few minutes, so please take your seats. As a matter of public safety, the fire marshal requests that you stay in your seats during the entire ceremony. We also ask that you turn off all cell phones at this time. This commencement is being professionally photographed, but you are welcome to use your camera or camcorder as long as you stay seated. Please be courteous in not blocking the view of others. After the commencement, we ask that you remain in your seats until the official party, faculty, and graduates have recessed from Royce Hall. Thank you for your cooperation. Ladies and gentlemen, the graduates. Ladies and gentlemen, the official party and faculty. Ladies and gentlemen, please stand for the playing of the national anthem.
Good afternoon and welcome to the 2018 UCLA Fielding School of Public Health Commencement Ceremony. Woo. Thank you, parents, brothers, sisters, spouses, partners, and friends. We know you played such an incredibly important role in getting our students, the graduates, here to begin with and getting them through their years here. We want to start with a thank you to you for all you've done so far in their careers and going forward. So can all family and friends please stand to be recognized? Thank you. It is truly your graduation, too. What a tremendous day. I have to admit before I talk that I literally do not remember 3 words from my own graduation. That having been said, I'm going to ask you, but you're far better students than I was, to remember 6 words. So those are North Star, learning, patient impatience, and love. And these are what I hope for you as you graduate. You each came to UCLA with such deep commitments to public health. Commitments to prevent communities from being exposed to toxins, to addressing diabetes or cardiovascular disease, to preventing the effects of climate change, to reducing inequalities. You came here with deeply held values about how you want to make a difference in the world. You all, and I know it, knowing so many of you and watching what you do, you all have strong internal compasses about what matters. So my first wish for you is that no matter how difficult the environment gets in which you have to work, and sometimes it will be difficult, that you always have that North Star, that you allow it to serve as a guide when you make the important decisions you're going to be making about where you work, about how you work, what you work on, who you work with, and how you work with others. So that's my first hope for you. Okay, what's next? Learning. You may not have figured this out yet because you're all so great at learning, but by definition, learning involves getting things wrong at least some of the time. So as brilliant as you all are, I expect that you're going to get things wrong some of the time. Follow a path you thought would help people's health and find out it doesn't. It happens to all of us. So the question isn't will it happen, it's how will you respond when it does happen. My hope for you is that you learn, keep learning, but also keep working to make a difference. President Theodore Roosevelt was a progressive, a Republican, a conservationist. He knew something about learning, and he knew something about risk, because I actually hope while you're learning, you're not going to get risk averse or shy about taking risks. So I just want to read you the essence of one of his quotes. It is not the critic who counts. The credit belongs to who is actually in the arena, whose face is marred by dust and sweat and blood, who strives valiantly, who errs, who comes up short again and again, because there is no effort without error and shortcoming, who at the best knows in the end the triumph of high achievement, and who at the worst, if one fails, at least fails while daring greatly. so that one's place shall never be with those cold and timid souls who neither know victory nor defeat. I know, class of 2018, you are not timid. So I look forward to continuing to learn with you. Now the next two words, patience, impatience. Change will take time. So over the first few years after I graduated, I received 3 little notes from Senator Ted Kennedy because I was working with him on trying to get paid sick days passed in the United States and paid parental leave. It was a privilege to work with him because he cared so deeply about ensuring everyone in the country got health care and that there were adequate income for everyone. So I had this idea that I would not put these notes from him, these little thank you notes, on the wall until we passed paid sick days across the whole country and paid parental leave across the whole country. Okay, you can kind of guess what happened because I know we haven't passed that yet. So I began to understand that the journey was going to take a long time. And then I decided I'd better put it on the wall anyway, so that I would remember the direction we were going in, and I would remember that I was traveling with many other people, some who wrote notes, some who didn't. So they're on the wall now. We still don't have national guarantees of these basic rights, but it has passed paid sick days, so that people don't lose jobs when they get sick. 10 states, 32 cities, 2 counties to date. So my wish for you there is to be patient, but also impatient. Impatient in a good way. Bill and Melinda Gates are right when they talk about impatient optimists, that matters. I hope you're going to be impatient and not think that we can wait about addressing climate, not think we can wait about the number of people who die every single year. Right now, an estimated 100,000 in the United States from entirely preventable causes. So my final word for you is love a lot. Love your friends, love your family. They're here with us. I'm so thrilled to see them all here. Care deeply about the people you work with. They are going to help you get over the hurdles, the expected and unexpected hurdles. So those are my graduation hopes for you. Keep your North Star. Keep learning. Keep your impatience, but be a little patient with yourself along the way and have plenty of love to help you. We look forward to marching with you every step of this way. The school will always be your home. Congratulations, class of 2018. To you. So it's my great pleasure now to introduce our keynote commencement speaker. So one of the traits of people who work in public health is that we understand that there are broad areas that impact health. Another trait is this optimism that we can make a difference and yet constantly rolling up our sleeves to work on it. And these completely characterize our commencement speaker, Carol Larson. She's president and CEO of the David and Lucile Packard Foundation, where she has worked for the last 28 years. And even though she may not know she's a public health person, because she's also a lawyer, public health has totally adopted her because of what she works on. She works on everything we care about. At Carol's direction, the Packard Foundation made a big bet to address climate change with a $500 million multi-year investment aiming at limiting global greenhouse gas emissions, followed by another $350 million commitment to augment and extend the work. Beyond climate change, she has, under her leadership, the foundation has worked on land conservation, on access to high-quality reproductive health care, on ensuring communities, families, and their children are supported and have the best chance at leading healthy lives, and many other issues. Carol has a phrase that I just learned last night, which I love, which is, go for the high-hanging fruit. So instead of just going for the low-hanging fruit, be willing to take on the hard things that are so important to do. Her numerous professional accomplishments were recognized by the Council on Foundations in 2016 with their highest honor, the Distinguished Service Award, which celebrates visionary leaders. On a personal note, we're delighted that Carol's family is here with us. Welcome. We are so delighted that her father, Lowell Larson, his friends, Ken and Eloise, and her brother, Tom Larson, are here. Please stand to be recognized. Thank you so much for joining us today. Please join me in welcoming this year's UCLA Fielding School of Public Health Keynote Commencement speaker, Carol Larson.
Well, good afternoon. Dean Heyman, I got to get this microphone right. Dean Heyman, Professor Fielding, faculty, parents, families, children, but most of all, we're going to keep doing this, the 2018 graduates of the UCLA Fielding School of Public Health. Let's give them another round. Yeah. You're probably going to hear that a lot today. So I am very honored to share this day with you. Coming in here, hearing the music, hearing the excitement, just made me so excited. It's infectious. This is such a beautiful setting with so many great events that have happened in here, and this has to be one of the better ones. But graduations this year, 2018, for me, are especially poignant because it was 40 years ago, 40, almost to the day, that I sat in your chair, having just completed my law training. So I'm really reflective on what did that feel like 40 years ago? What's happened since then? I have two daughters, they're 26 and 22, and they said, so Mom, what's your advice after all that time? What do you have to say to the graduates? And when you actually start to think about it, you really wonder, that's a pretty daunting question. I start by remembering how I felt when I sat in your chair. It was 1978. I was graduating from Yale Law School. The ceremony was outside in the courtyard. And I was really excited, but I frankly was really scared. I was really proud, but I also was very uncertain. I knew what my next job was, which was to come here to Los Angeles and clerk for a federal judge for 1 year, but I didn't know what would happen after that. Some of you may be in the same position. You know your one next step, but you don't know what's going to happen after that. Frankly, if someone had come up to me that day in my cap and gown and tapped me on the shoulder and said that 40 years from now you'll be president of one of the country's largest foundations, and you'll have a chance to address the UCLA 2018 graduates of the School of Public Health, I would have fallen off my chair. I never dreamed about that. I never imagined that I would have had these kinds of opportunities. So my main message today is that you really don't know. One can't predict what your circumstances will be, what the context of the world will offer, or the opportunities of your lifetime. But what you can do is shape how you will show up in the world, how you will show up. You know, there's that popular phrase, 80% of success is showing up, but I disagree. I think 100% of success is how you show up. I have learned over the 40 years that if we pay attention to that, to how we show up in the world, we will have joy, we will be productive, we will have impact. So I thought today I would just share a few stories about some of the attributes that I think have been important about how to show up and what I've admired in others that I've seen. Dean Heyman had 5 or 6 words, and I have 5 attributes, so you have a lot to remember, but there's a lot of similarity. First, show up with gratitude. That's an easy thing to say at a graduation, surrounded by your parents and family. I remember back to the day in 1978, my dad, sitting right there, was there with me 40 years ago, sitting in that courtyard. And my mom, too. She unfortunately died at a fairly early age of 74. But my dad and mom carried with them a note from my grandpa. My grandpa was a farmer in rural Minnesota. And me going to law school on the East Coast was really far away from anything he had imagined or experienced. He and my grandma had, with my dad, driven me back across the country 3 years earlier to start my graduate work at Yale. My grandma went to the nearest store and bought me a mop and made sure that my dorm room floor was clean. So I bet that sounds familiar to some of you who have had similar support from your relatives. But it was clearly a different world for them. 3 years later, on graduation day, they couldn't make the trip back east anymore, so my grandpa wrote me a note instead, which I have saved. He said, "Carol, you sure have made a wonderful life for yourself. All the places you have been and all the great people you have met." Well, even then, 40 years ago in my 20s, I knew that that wasn't quite right. A wonderful world that I've made for myself, just as you know today, you have not made this for yourself. I had not made that for myself. My parents, friends, brothers, grandparents, teachers, mentors, all had played a part. When I spoke with Dean Heyman about doing this, she told me that 20% of you, 1 in 5, are the first in your family to have graduated from college. That is wonderful. That is incredible. And I'm sure all the graduates, but especially those of you, know what I'm talking about. Your parents and your grandparents and those involved in your life didn't have the same opportunities that you've had. Guess what? The debt of gratitude keeps growing. My dad and brother who are here stood with me for the next 40 years and continued. My debt of gratitude to them continues to grow. And your debt of gratitude to all of those who brought you here today and all of those sitting on the stage will also continue to grow. But remembering gratitude and remembering your interdependence on others also helps you in your career. It helps me learn to be a CEO. 14 years ago, when the Packard Foundation board gave me that honor, and I first got that title, I thought, hey, I can do this. I'd just gone through all these rounds of interviewing. I know how to do this, and after all, I'm called Chief Executive Officer. But it didn't take me long to realize that it wasn't going to be about me, and there wasn't anything I could do, no matter how much of a title I had, if I didn't have a team of people that I was dependent on and that we worked together. Over these 40 years of my law career, I've had a chance to see so many effective people accomplishing huge social change. But it's been those people who recognize their teamwork that have made the most difference. It's not been the accomplishments of these years. It hasn't been about single heroic acts, but rather about consistent, tenacious teamwork. So my first message to you is, it matters how you show up, and show up with gratitude. A good leader never forgets those who shaped them. And a good leader never forgets those who open doors for you and commits to opening doors for others. Second, show up with courage. Speak your truth. Now, some of us are introverts, some of us are extroverts, but no matter what your personality, you're going to have times and moments in your life, both small and big, where you'll need to speak up and you'll need to speak your truth. That same farmer grandpa who wrote me the note back in 1978 taught me a lesson about this too. The year before, after my second year of law school, I worked for a law firm in Minneapolis. And at the end of the summer, the tradition is if they like you, they'll take you out to lunch and make you an offer to come back and work for them 3 years later. Now remember, this was 40 years ago, but still, it was just 1978. So on that last day, the law firm decided to take me lunch, and they were going to make me an offer to come back. We walked to a nice building in downtown Minneapolis. We looked into the dining room. It was beautiful. Green leather, shining brass, dark wood. But we didn't sit there. Instead, we went up a side stairway into the second floor, and it was a bright, sunny room with tables with white tablecloths and roses in the center. So it was a great lunch, and they made me the offer, and I was delighted to have it. But when I went back to the law firm, one of the young lawyers said, "Wow, I can't believe that, Carol. They took you to a club that discriminates against women. In the dining room that you ate in, that bright, sunny one, that was the dining room for women." That was just 40 years ago, but I know that that kind of discrimination has happened along race and other lines much in a continuous way and frequently. Well, I wasn't going to say anything. I just went back, packed up. I was going to go back to law school for my third year, put my head down, get the degree. But that weekend after leaving the firm and before heading back to school, I made the 100-mile drive through the countryside of Minnesota to visit my parents and my grandparents. And surprisingly, my grandpa said to me when he heard that story, he said, "That's not good enough. You go back and you tell that law firm that that was not right." So that was a small moment in some ways in life, but that small moment was really an important message for me coming from him. Show up with courage. Well, after law school, I did come here to LA. I did clerk for a judge. I did not go back to that law firm in Minneapolis. Instead, I took a job here in LA working for a nonprofit organization that served developmentally disabled people. And there, every day, I really saw people who showed up with courage. The Right to Education for the Handicapped Act had just been passed by Congress, and parents had a whole slew of new legal rights to advocate for their developmentally disabled child to get the services they need in school. So Congress passed the law, but it was the parents who provided the courage. Every day, every year, year after year, those parents needed to show up with courage and tell the schools, "Hey, what you're doing for my child is not good enough. You must do more." So I bet you graduates already speak your truth about race, about gender, about inequities, about rights. And it's important that you continue to do that throughout your career and life. Third, show up with respect. After that work at that nonprofit, I went to work for a law firm here in LA and stayed practicing civil commercial litigation for 7 years, became a partner. But I realized that far into it that I was enjoying my evenings and weekends serving on boards of nonprofits much more than I was enjoying my day job. So I rolled the dice, I started looking around, decided to go back to the nonprofit sector, took a big salary cut, and got this job as a program officer with the Packard Foundation in Northern California. So all of a sudden, I had the privilege of less salary, but the privilege of directing real dollars to nonprofit organizations working really hard to improve the world. So as someone who has resources that you're directing, as a grant maker, you soon realize that you are one step removed, that there's a true power imbalance, that there's a gap between you who represents resources and those who seek those resources. And if you don't watch out, you can be out of touch and make distorted decisions. At Packard, we try to really emphasize with our employees that effective work begins first with respect, and that respect begins with listening, true deep listening to the nonprofits that work with us and also the communities in which they work. If I'm honest, foundations, and including our own, still need to improve in this area. But at Packard, I know our practices did get better when we started to regularly survey our grantees, and also that when we started to shape our approaches and strategies with them and the communities they served. So how you show up matters. Show up with respect, beginning with listening. But I'm talking about philanthropy, and I think that message is relevant to all of you. Many of you in your first careers, in your first next steps, will be working at systems levels and analyzing data and poring over new policies in government. You can get pretty far removed from the people with whom you're trying to serve and be helpful. So beware of that. Beware of that gap, and don't stop listening to those you are seeking to help. And listen with the willingness to actually change what you're doing as a result of what you're hearing. Fourth, show up with heart. Another life lesson for me over these years wasn't just to get beyond the papers and the podiums and the desks and listen, but also to get beyond those and really try to feel with your heart. Melinda Gates, at another graduation 4 years ago, happened to be one of my daughter's graduations, urged the graduates, let your heart break. Throughout your career, let your heart break. It's too easy over 40 years, decades of career, to become so busy and so knowledgeable, so adept at analysis and articulation that you stop feeling. Guard against that. Open your heart to those feelings, needs, life experiences of those you seek to help. I was reminded of this once again recently on a trip to Mississippi and Louisiana, where our foundation over the last 5 years has been providing financial support to advocates and public health professionals and service providers to try to increase access to quality reproductive health care for women in those states. On paper, those numbers clearly show barriers to women, especially women of color, barriers to quality and affordable care. But it's an entirely different experience to read those surveys at your desk than to go there and visit and listen and feel. On a recent trip to those states, I visited crowded waiting rooms where young women had traveled long distances, often had to take time off from work, often had to borrow money to pay for the services they were seeking, and now still faced a long wait. Even worse was the need for some of them to walk through picket lines and people yelling at them because they were seeking family planning or, in some cases, abortion services at the one remaining clinic in Mississippi. These were barriers to health care that I never had to face, that my daughters have never had to face. And it's important for me and all of us to feel that different reality and to let our hearts break. Again, there are likely parallels with you entering public health careers. Some of you will go work on the ground and in community right away, and I bet you your heart will break, often. Others of you will go into government or into academia or in large agencies, but whatever you do, be sure to create that time in your life and work for you to stop, listen, feel, experience, let your heart break. Finally, and this is a great thing, Dean Heyman mentioned it too, and we are at UCLA, finally, show up with optimism. Clear-eyed, pragmatic, yes, but optimism. The kind of optimism that is willing to acknowledge and celebrate the progress of the past, but pushes you to work even harder for the future. I love the statement on the UCLA website, for Optimist website. It says, at UCLA, optimism is a doubt-defying state of mind. It's California dreaming blended with daring, impactful doing. As I look back on my 40 years since I graduated, in every area, I too feel what the dean was saying, patient impatience, or I was going to say restless optimism. There is progress to acknowledge, but there is also so much work to do. Just take climate change, stemming greenhouse gas emissions. That's a really big public health issue that I know many of you are working on. So I went back to the records for Los Angeles to 1978. And do you realize that during those years, so 40 years ago, there were nearly 150 days when the air registered at what they called stage 1, when it was so unhealthy that all children, not just some, were supposed to discontinue all vigorous activity, no matter what the duration. That's a lot of days, more than 1 in 3. I know you have still air advisory warnings now, but it's very infrequent, if ever, that it reaches that level of unhealthy air in Los Angeles. Huge progress. Looking globally, back in 1978, climate change was hardly discussed or little understood. And today, 196 countries, although I haven't read the news today, maybe it's 195, have signed the Paris Agreement with the goal of keeping greenhouse gases down so that the global average temperature will be well below 2 degrees centigrade above pre-industrial levels. But of course we need to do much more. We need to go farther, and we need to go faster. But look what's happening this year. Despite abandonment at a federal level, there is real progress. This year, in September, there will be the California Climate Summit. And thousands of people from around this country, from communities, cities, and states, and really from around the world, will gather in San Francisco to say, we're not going back, to recommit themselves to making progress towards stemming climate change, and to do it further and faster. Many of those who gather will have public health backgrounds and will be working in communities or all the way up at global levels to stem climate change. Now that summit, if it leads to real action and commitment, is a great example of California dreaming blended with daring, impactful change. So my advice is life is not simply about showing up, it's about how you show up. And if you show up with gratitude, courage, respect, heart, and optimism, you will be joyful. What will that world look like that you're entering with your newly minted public health degree? You are entering the field of public health at a perfect time. The progress of the past, the new tools of analysis of the present, give us the opportunity to really accelerate the progress in public health. You're also entering a time when the world needs you, our country needs you, Los Angeles needs you more than ever. We need your systems thinking and command of data if we are to contain Zika and Ebola, address climate change, or address the domestic crises of mental health or opioid addiction or gun violence. We need your commitment to equity, a commitment to not just privileged health for the rich, but to quality public health for all. We need your focus on the power of science. We will not succeed if we are not rigorous in protecting evidence and scientific integrity. And we need your cross-boundary thinking. Climate change, for example, is connected to health, to gender equity, to income inequality. And if we're going to make any lasting, sustainable progress, we need people like you who have been trained in cross-boundary thinking and are committed to find solutions that last. So you are entering the right profession at the right time and in a world that needs you more than ever. So finally, I bet you can't even imagine what you'll be like 40 years from now. I bet you that seems awfully old, as it did back to me in 1978. The good news is that when you actually get there, it doesn't feel that old. But what will your 40 years bring? Where will you be on your 40th reunion? I hope you'll be here, getting together with your classmates 4 decades into your career, and that you'll be grateful as you are today to the school that brought you here. I don't know, though, what your trajectory will be in life or your career. You don't know, and I'm sure there will be twists and turns along the way. But I do know you will show up. And if you pay attention to how you show up, I do know that you will live a joyful, productive, and impactful life. So let me end with the words of my grandpa, who wrote me that note in 1978. You sure have made a wonderful life for yourself. All the places you have been, and all the great people you have met. So go forth with gratitude, courage, respect, heart, and optimism. Have a wonderful journey. Thank you.
Thank you so much, Carol. Those are words I'm going to remember too, as these journeys continue for a long time. But for now, we're going to hear some more. So this spring, with the leadership of Hajar Ahmed, co-president of our Public Health Student Association, or PHSA, we are reigniting the tradition of a student commencement speaker. Hajar, soon-to-be MPH graduate from the Department of Health Policy and Management, has served on the board of PHSA for 2 years, was the 2018 Lester Breslow Student Public Health Challenge Grand Prize winner, and has spent the past year serving as an academic counselor to undergraduate students. Thank you, Hajar, for your service to our school and across the university campus. Hajar will share for a moment about PHSA and then introduce the 2018 student speaker. Please join me in welcoming Hajar. Welcome.
Good evening, everyone, and congratulations to us, the graduating class of 2018. Thank you, Dean Heyman, for those kind words, and it's been an absolute pleasure to serve as your co-president for PHSA this past year. Of course, none of this would have been possible without the help of my fantastic executive board members who are graduating today. Rajia Ragab, Elaine Harrow, Leah Hunsinger, Cindy Beard, and Veronica Kapoor. Thank you, ladies, for your hard work, and it's been an absolute pleasure working with you. We've had an incredible year of activism, volunteering, and fun. Some of these events included working with Under the Bridge, a foundation that helped make lunch for the homeless, connecting undergrads who are interested in public health with our own graduate students through our partnership with the Building Heroes Project, meeting weekly for Run Club, enjoying bonfires by the beach and jazz night at LACMA, and of course, our end of the year banquet. This year, PHSA is excited to announce that we have brought back the tradition of having a student speaker. Nicole Nick Lamantia, in mere moments, will be a graduate with a Master in Public Health for Health Professionals from the Department of Community Health Sciences. She will finish up her residency in UCLA's Pediatric Dentistry program this July. Please join me in welcoming her, Nicole Nick Lamantia.
Good evening. As public health professionals, we see the best and the worst in humanity. A few weeks ago, a professor of mine asked me a question. He asked me, what is the difference in dental care in South Central Los Angeles and West Los Angeles? I thought, okay, I'm ready to graduate, I should know this. Instead, I asked, what is it? $39.99, he said. In South Central Los Angeles, you'll see signs. Tooth extraction, $39.99. What's a tooth extraction? It's a failure. It means that everything that we've tried to do just wasn't enough. It's our last option. And although a tooth extraction is $39.99, saving a tooth is priceless. So in West LA, you don't see signs for tooth extraction. Instead, tooth whitening, braces, veneers. So why is that? In order to have good overall health, you must have good oral, in order to have good oral health, you must have good overall health, which means adequate access to resources in our homes, our neighborhoods, our communities. It means quality schools, safe workplaces, clean air, water, and food, and social and economic opportunities. Theodore Parker, a reformer who once inspired speeches by Abraham Lincoln and Martin Luther King Jr., once said, "As society advances, the standard of poverty rises. Those who lack essential health care and access to care limit our ability as a country to move forward towards health. Our society should be focused on health equity, and we, equipped with the knowledge and skills that we've learned here at UCLA, are in the perfect position to be change agents towards that goal. As we have experienced throughout our training, we must be ready for the many challenges that will come in our future. So how do we approach this? Let me tell you. I'd like to share a story, The Parable of the Pencil by Paulo Coelho. In this work, he tells a story of a pencil and a pencil maker. I know what you're thinking. Public health, pencils, I don't really get it. Who even uses pencils? Well, here's how the story goes. The pencil maker took the pencil, and before putting it in the box, he said to it, "There are 5 things you need to know before I send you out into the world. Always remember them, never forget, and you will be the best pencil you can be. 1, you will be able to do many great things, but only if you allow yourself to be held in someone's hand. 2, you will experience a painful sharpening from time to time, but you need it to be a good pencil. 3, you will be able to correct any mistakes you might make. 4, the most important part of you is what's inside. And 5, on every surface you are used, You must leave your mark. No matter the condition, you must continue to write. Okay, the pencil understood and it went into the box with purpose in its heart. Now, let's replace the pencil with ourselves. And if we remember these things and never forget them, we will become the best public health professionals we can be. 1, you will be able to do many great things, but only if you allow yourself to be held, to be supported, to trust, and to be trusted. 2, you too will experience a painful sharpening from time to time during periods of uncertainty in our career. But you need it to build character, to become astute and conscious of those around you. 3, you will be able to correct any mistakes you may make. So don't be afraid to put yourself out there, take a risk. We may stumble, but we can always redirect our path. 4, the most important part of you is what's inside. Always maintain professional ethics, standards, and values. Act with integrity. This is what defines us as professionals. And 5, on every surface you walk, you must leave your mark. No matter what the situation, you must continue to persevere. Leave your legacy and continue to leave your mark on every path that life takes you. Remember the pencil. Remember the fundamental lessons you have learned here. Thank you, and congratulations.
Thank you so much, Neek. Okay, so I'm kind of worried. I told you I couldn't remember 3 things, and we've asked you to remember 16, I think, now. But I do think that class of 2018 and all family and friends, you are going to remember what comes next, because this is a pretty unique aspect of our graduation and one of our favorites here at the Fielding School of Public Health. So the graduates know what's coming. Every weekday at 2:30 in an office shared by 2 of our centers, Center for Cancer Prevention and Control, the Kaiser Center for Health Equity, you'll find faculty, staff, students, visitors doing aerobic exercise set to music. We really believe the public health thing. So this is a brief interlude, but an important interlude in the day, and we're about to do it at graduation, and we're going to do it to honor a very special member of our Fielding School family. You'll find exercise breaks like this across the UCLA campus and actually across the country, inspired by the fitness movement pioneered by the late Fielding School professor, Dr. Tony Yancey. So what was her concept? Her concept was that even short bursts of exercise would make an enormous difference in your health. And indeed they do if you find time in school and offices, in your house, in your community. And I think you're about to feel the joy of this. So leading us this year will be Julia Fagelman, a master's student from the Department of Community Health Sciences. And yes, family and friends, this is a required activity, so please do stand up with us and the graduates. Take it away, Julia.
All right, hello guys. I'm so excited and it's not even my graduation. I see some familiar faces. let's spice things up, all right? Everyone, okay, you're already standing, so I don't even need to tell you. We're gonna get moving, we're gonna get the blood flowing, so let's cue music. Here we go. Let's just warm up with some side to side. All right, we're gonna engage our arms. Woo! Good job, and point. Don't be afraid to look silly, it's cool. Arms up. All right, we're gonna do some clapping. Woo! This is a big day, guys. All right, we're gonna get loosey-goosey. Couple more, you got this. Making sure everyone's doing it. From the top. Just wave your arms around any way you want. And point. Point to the sky. From the top. Good job, good job. And we're pointing. All right, and we're gonna clap. You're happy, you're graduating. And get loose. You don't have to turn if you don't want to. And clap. Let's get the arms going. All right, we're gonna wave. And down. Bring it up. And down. You got this. You have a master's degree. You can do this. Bring it up. From the top. And down. Just a couple more. We're almost there. From the top. All right, good job, guys. Congratulations. Thank all you guys.
Thank you for joining us, everyone, in that. And thank you, Julia, for leading it. We will now start the part of the ceremony that I suspect is the main reason most of you are here today, the conferring of the degrees on our graduates. You may have noticed that the hoods of the faculty and graduates are a variety of colors. The colors represent the different degrees. Salmon for our Master of Public Health and Doctor of Public Health. Blue for the Master of Science and Doctor of Philosophy. And then other colors, purple for law, green for medical degree. We will begin with the master's students. And before we do, I just, as a parent, want to say a word to the parents here. So for those of you who are wondering, how am I going to get a photo of my son, daughter, or spouses, or siblings who are wondering, in addition to the usual photographers that graduations have, I'm thrilled that we're joined by Jane Huell, who does photography for the school. It is going to be available free online. She's a master photographer, takes photos for Vogue, for the New York Times, and you will see her photos are indeed spectacular. So give a big thank you to Jane. And then just enjoy. So Associate Dean Hillary Godwin will now read the names of the graduates. First, the Master of Public Health, followed by the Master of Science, one department at a time.
We'll begin by recognizing master's degree recipients by department. To start, I'd like to ask Professor Banerjee, Chair of the Department of Biostatistics, to come forward, and the Faculty of Biostatistics to stand. Yay! Cameron Scott Goldbeck. Talia Hodes. Sarah G. Kimberly Knopik. Wait up a second. Najin Kyung. Zinya Liu. Sangeeta Mundell. John Solomon. Katie Wang. Liwen Gao. Zhenyu Zhang. Thank you, Dr. Banerjee. Will the Chair of the Department of Community Health Sciences, Dr. Mike Prelip, please come forward? And will the faculty of the Department of Community Health Sciences please rise? Amy Elizabeth Alterman Paradiso. Emily Elizabeth Bell. Trista Benitez. Jennifer Carney. Karwai Chan. Amanda Daigle. Angelica Delgado. Catherine Strong. Emily Farrow. Marisol Frasto. Saul Garcia. Lorena Calatena Gonzalez. Elaine Yaritza Harrow. Ayla Hernandez. Win Huang. Christina Hunter O'Leary. Francis Quinn. Jenny Quinn. Paulette Annie Nianogo Ima. Joyce Amafidon. Ronnie Kuahara. Bernadette Legis. Rachel Lesser. Carissa Lim. Jing Fan Lim. Elise Liu. Julie Locke. Anna Michelle McSorley. Marilyn Moreno. Michaela Newsom. Monica Pong. Mariana Reyes. Elizabeth Rocha. Jillian Silver. Elise Wallace. Let them go. Thank you, Dr. Prelip. Will you, as Program Director for the Masters of Public Health for Health Professionals and Community Health Sciences and the faculty of the Department of Community Health Sciences, please remain standing? Nak Chiv. Michael W. Esters. Anna Rose Gorman. Vivian Kanchian. Elaine Kim. Nicole Lamantia. Catherine Pham. Thank you, Dr. Prelip. Will the Chair of the Department of Environmental Health Sciences, Dr. Michael Jarrett, please come forward? And will the faculty of the Department of Environmental Health Sciences please rise? Jasneet Baines. Areli Reseño. Yuzu Chen. Rachel Connolly. Anthony Crimes. Catherine Elise Gibbs. Howning Gong. Leah Pauline Hunsinger. Margaret Sandra Iseed. Monica Lee. Joshua Lin. Diana Nguyen. Hong Tai Pei. Robert Rainey. Joyce Thung. Wei. Thank you, Dr. Jarrett. Will the chair of the Department of Epidemiology, Dr. Karen Michaels, please come forward? And will the faculty of the Department of Epidemiology please rise? Cindy Agus. Onyemechi Onaruo. To Thiri Ong. Trevor Ayers. Cindy Beard. Alisa Dratch. Nicole Higashiyama. Chi Meng. Brittany Meyer. Kathy No. Somin O. Catherine Takeshita. Graham Toth. Lorena Ulloa. Mark Wainwright. Liu Young. Healing Zhao. Xinyu Zhao. Thank you, Dr. Michaels. Will the chair of the Department of Health Policy and Management, Dr. Jack Needleman, please come forward? And will the faculty of the Department of Health Policy and Management please rise? Hajar Ahmed. Molly Brown. Annie Chen. Samuel Konovitz. Richard Dombreke. Priyanka Fernandez. Candice Grignani. Kim Michelle Hargis. Dr. Kay Hushman. Olivia Ishibashi. Isha Jagtap. Michael Jan. Sarah Whittaker Johnson. Veronica Kapoor. Brian James Keys. Daniel Cosman. Vanessa Fungni Lam. Whitney Lee. Sao Yu Liu. Andrew Loberg. Emily Methankul. Brian Phillips. Courtney Porter. Adam Rabb. Rajia Ragab. Roberto Nelson Ramos. Hannah Reichel. Jeanette Renaga. Ariel Sharfstein. Diana Soto. Catherine Suratsky. Alan Tang. Sarah Ulaneski. Donya Sassy. Angela Lucia Benegas Moreo. Veronica Viseñas. Marwin Young. Thank you, Dr. Needleman. Will the Program Director for the Executive Masters in Public Health with Health Policy and Management, Dr. Leah Briesman, please come forward? And the faculty, and the faculty of the Department of Health Policy and Management should continue to stand. Kaylee Alexander. Vivian Bean. Nicholas Bloom. Natalie Chow. Carlos Samson Chavez. Sharon Chu. Elizabeth Dew. Eric Echeverry. Eric El-Tabgi. Samuel Gonzalez. Eugene Lee Kim. Kristen Leahy. Nathaniel J. Luza. Cosette Leon Jones. Knackle. Raymond Oppel. Jennifer Parrott. Pamela Cicada. Angela Stork Peterson. Okay, great, thank you. Johnny Hushiar Tan. Seema Vora. Pamela Vona. Thank you, Dr. Vriesman. Dean Hyman, I return the podium to you.
This concludes the presentation of our master's candidates. Will the candidates for the degrees of Masters of Public Health and Master of Science class of 2018 please rise? By the power vested in me by the Regents of the University of California, I bestow upon you the degree of Master of Public Health or Master of Science with all the rights and privileges pertaining thereto. Congratulations, class of 2018. What an accomplishment, and it's only the beginning. Thank you, master's students. We will now recognize the doctoral degree recipients by department. First, we will have Professor Sudipto Banerjee, Chair of the Department of Biostatistics.
Thank you, and welcome everyone, and congratulations to class of 2018. On behalf of my department, we are very pleased to present the doctoral candidates, doctoral students, graduating doctoral students. So, let's start. Okay, sure, I'll do that. Okay, so, whatever you think of biostatistics, it's hard to beat us in terms of innovative and exotic dissertation titles. So our first graduating student is Daniel Joshua Kohn, and his dissertation title, listen carefully, is Utilization of Low-Dimensional Structure to Improve the Performance in High Dimensions. And he will be hooted by his co-chairs, Professor Gong Li and Professor Cristina Ramirez. Just wait for a second. Okay. Our next graduating student is Qian Li, and here's the title of his dissertation, Hierarchical Integration of Heterogeneous, Highly Structured Data, the Case of Functional Brain Imaging. So that's us. And the chair of his dissertation is Professor Donatella Telesca. Unfortunately, he's not able to make it today, so he will be hooted also by Professor Gong Li.
Next, we will have Professor Mike Prelip, Chair of the Department of Community Health Sciences.
Thank you. This is the best day of the year, right? It's just great. Congratulations, everyone. Okay, so I am excited to get to do this for the very first time. And our first doctoral student today is Deanna R. Bird. And Deanna Roger Bird. Oh, I see it right here. Now I'll get it down. You're my first one. Okay? Thank you. And the title of her dissertation is A Longitudinal Study of Black-White Disparities in Cognitive Aging. Today she's going to be hooded by her chair. Dr. Gilbert G., Professor G. Congratulations, Dr. Bird. Okay. Our next candidate is Elvira Jimenez, and the title of her dissertation is Off-Time Dementia Caregiving, the Experience of Early Onset Dementia on Spousal Caregivers. Today she'll be heard by her chair, Professor Stephen Wallace. Congratulations, Dr. Jimenez. Okay, our next candidate is Imelda Padilla Frausto, And the title of her dissertation is Latinos' Use of Mental Health-Related Services, Using a Health Crit and Lat Crit Lens to Examine the Role of Perceived Ethnic Discrimination as a Socio-Environmental Consequence of Living in a Racialized Society. You get the award for the longest. Putting her today is the chair of her committee, Professor Stephen Wallace. Congratulations, Dr. Padilla-Frasto. Okay, our next candidate is Helen Reese, and the title of Helen's dissertation is I'm Not Ready Yet, Intrapersonal and Interpersonal Processes Shaping the Adoption of Personal Emergency Response Systems Among Older Adults. Hooding her day will be her co-chairs, Professor Stephen Wallace and Professor Carol Anna Sensal. Congratulations, Dr. Reese. Our next candidate is Brenda Robles, and the title of her dissertation is Evaluating Community and Individual Level Psychosocial Factors to Improve Chronic Disease-Related Dietary Behaviors, a case study of Los Angeles County. Hooding her is Professor Courtney Thomas, the chair of her committee. Congratulations, Dr. Robles. Okay. And our next is Maria Elena de Trinidad Young, and the title of her dissertation is Producing Citizenship Position Through State Immigrant Policies, an examination of the relationships between health policy, citizenship, and race in the United States. And Elena is being hooded by her chair of her committee, Professor Stephen Wallace. Congratulations, Dr. Young.
Next, Professor Michael Jarrett, Chair of the Department of Environmental Health Sciences.
Thank you, Dean Heyman. It's my pleasure to present the candidates for the doctorate degree in environmental health science. First, we have Savannah Carson. Her chair was Dr. Hilary Godwin. Her thesis was entitled The People of the Forest, Indigenous Voices for Agency, Sustainability, and the Health of the Forest and Conservation. The Biostatistics Department may have the most complex titles, but we certainly have among the longest, I think. So, next we have John Diaz de Caro. His chair is Hilary Godwin, and she'll be hooding him. His thesis is entitled Combating Circulating Infectious Diseases in California, Evaluating New Approaches to Surveillance and the Cost of Outbreaks on Public Health Agencies. Next is Katie McNamara. Her chair is Wendy Robbins, and she'll be hooding her. This is a nice shorter title, The Health Effects of Rotating Shift Work in the Oil Industry. Next, we have Tyler Watson, again chaired by Dr. Hillary Godwin. His thesis is entitled Emerging Topics in Food Insecurity, an Assessment of University Student Food Access and Urban Agriculture in Los Angeles.
Next, we will have Professor Oliver Hankinson, Director of Molecular Toxicology.
It's my pleasure to introduce our PhD student graduating this year, who's Michael Deverin. And Michael's chair is Robert Schistel, but unfortunately Dr. Schistel is in Europe at this time, so I will be hooding him. Where is the hood?
Next, we will have Professor Karen Michaels, Chair of the Department of Epidemiology.
Greetings. It is my distinct honor and pleasure to introduce the doctoral candidates for the core science in public health, epidemiology. Our first candidate is Laura Jane Anderson. The topic of her doctoral thesis is Predictors of Repeat STIs and the Efficacy and Economic Impact of a Financial Incentive Program for STI HIV testing among men who have sex with men. The chair of her doctoral committee, Professor Javanbakht, will assist with the hooding. Congratulations, Dr. Anderson. Our next candidate is Zoe Gabrielle Baker. The topic of her thesis is the impact of partner factors on HIV pre-exposure prophylaxis and antiretroviral therapy adherence. The chair of her doctoral committee, Professor Gorbach, will assist with the hooding. Congratulations, Dr. Baker. Our next candidate is Chun Pin Chang. The topic of her doctoral thesis is glycemic index, glycemic load, genetic susceptibility, and their interactions with lung and upper aerodigestive tract cancers. The chair of her doctoral committee, Professor Zhuo Fang Zhang, will assist with the hooding. Congratulations, Dr. Chang. Our next candidate is Hilary Kyle Xu. The topic of the thesis is identifying longitudinal risk factors for anal high-risk HPV infections and strategies to better detect anal high-grade dysplasia for anal cancer screening in older men who have sex with men. The chair of his doctoral committee, Professor Javan Bakht, will assist with the hooding. Thank you. Congratulations, Dr. Shu. Our next candidate is not yet doctor, 1 second. Chen Xiaoling. The topic of her doctoral thesis is agricultural pesticide exposure, adverse birth outcomes, and childhood cancers in California. Professor Maeda will assist with the hooding. Congratulations, Dr. Ling. Our next candidate is Caleb Lowe. The topic of his doctoral thesis is sexually transmitted diseases among older people in Los Angeles County in 2000 to 2011. The chair of his doctoral committee, Professor Dietels, will assist with the hooding. Congratulations, Dr. Liu. Our next candidate is Adam Reedhead. The topic of his thesis is tuberculosis disease incidence estimation among foreign-born persons in Los Angeles County, 2005 to 2011. The co-chairs of his thesis committee, Professor Dietels and Professor Civillo, will assist with the hooding. Congratulations, Dr. Reedhead. Our next candidate is Ai-Fan Shi. The topic of her thesis is Influences of Physical Activity on Risk of Parkinson's Disease and Cognitive Decline in Elderly Hispanics. Professor Maeda will assist with the hooding. Congratulations, Dr. Shi. Our next candidate is Chelsea Shover. The topic of her thesis is How Substance Abuse, Health Insurance, and Social Determinants of Health Affect the HIV Prevention Continuum in Los Angeles. Focus on pre-exposure prophylaxis and treatment as prevention. The chair of her doctoral committee, Professor Gorbach, is assisting with the hooding. Congratulations, Dr. Schober. Our next candidate is Dana Lakshmi Tirumalai. The topic of her doctoral thesis is Association between HIV infection and intimate partner violence among married Indian women in Thane District, India. The chair of her doctoral committee, Professor Dietels, will assist with the hooding. Congratulations, Dr. Tirumalai. Our next candidate is Drew Westmoreland. The title of her thesis is Risky Business, Sexual Health Behavior, Butt Stuff, and Whether People Will Talk About It. We do fun stuff in epidemiology. The chair of her doctoral committee, Professor Jabanbach, assisted with the hooding. Congratulations, Dr. Westmoreland. You're done.
Next, we will hear from Professor Jack Needleman, Chair of the Department of Health Policy and Management.
Thank you, Dean Hyman. On behalf of myself and my faculty, I want to also extend congratulations to the class of 2018. Robin? I am pleased to present the candidates for the doctoral degrees in our department. Our first candidate is Robin Flint McBride, who is receiving the Doctor of Public Health. The title of her dissertation is Applying System Science Methods to Risk-Based Disease Management and Population Oral Health. Her chair, Neil Halfin, will assist in her hooding. And congratulations, Dr. Flint McBride. Our next candidate is Ida Caterina Garcia Appendini. The title of her dissertation was The Effects of Mexico's Seguro Popular program on health-related outcomes, 10 years after its implementation. Her chair was Arturo Vargas Bustamante, who will assist in her hooding. Congratulations, Dr. Garcia Appendini. How do you pronounce your last name? Shikans. Thank you. Our next candidate is Adam Shikans. The title of his dissertation was The Impact of Adverse Childhood Experiences on Household Resources, Intergenerational Risk of Adversity, and Behavior Problems in Subsequent Generations. His committee chair was Paul Chung, who could not be here. He will be hooded by Neil Halfin, a member of his committee. Congratulations, Dr. Shikans. And our last candidate for today is Adrienne Wynn. The title of her dissertation was Evaluating Routine Testing and Treatment for Sexually Transmitted Infections Among Pregnant Women in Southern Africa. Her chairs were Rashan Bastani and Beth Glenn. Dr. Glenn will assist in her hooding. And congratulations, Dr. Wynn.
This concludes the presentation of our doctoral candidates. Will the candidates for the degree of Doctor of Philosophy, class of 2018, please rise? Stay risen. By the power vested in me by the Regents of the University of California, I bestow upon you the degree of Doctor of Philosophy with all of the rights and privileges pertaining thereto. Congratulations, class of 2018. Okay. Countless congratulations to all of our new degree holders. Graduates, as you move forward, know that we are proud of you. We are excited about all you're going to bring to transforming health. And know that the Fielding School is always your home. Come back. Let us know how we can help. Let us know how we can walk hand in hand on the journey you're going to be on. When there are challenges, know that we have the shared goals you do, and we want to be there for you. Heartfelt thanks to your family and friends for being here with us today. It's you all being here that make it such an extraordinary celebration. Please join us for a reception. It'll be held right outside. Keep your eye out for Jane Yule, the photographer, if you want a family shot, friend shot, graduates together shots. We do ask that you please allow the graduates and the faculty to first depart the auditorium. For now, I just want to say thank you all again and join me in congratulating the class of 2018.
Okay. When I dump out all these out into a bucket and dump it outside, I figure maybe that'll do something.
Make the world a little better.
Maybe. Possibly.